Hello and a warm welcome to another exciting episode of Beyond Pharmacy School. If you're a pharmacy student, a recent graduate, or interested in exploring oncology pharmacy, this is your episode. Now, today we are privileged to have an experienced oncology pharmacist. She will walk us through what oncology pharmacy entails, the steps in becoming one, and what a day in the life of an oncology pharmacist looks like. But before then, she will walk us through her own journey because every specialist started somewhere. Karibu daktari.
Thank you so much, Dr. Diana.
How are you today?
I'm very well.
Uh-huh.
Yes, thank you for this opportunity to even share my experience and, encourage others to join this field.
We are honored to have you because this is a field that you're very passionate about.
Very passionate.
Yeah.
Yeah.
To start us off, could you introduce yourself?
So to start with, I'm Dr. Winnie Mwangi.
Uh-huh.
I'm a clinical pharmacist with specialization in oncology. Yes, and I've been practicing oncology pharmacy for the last almost 14 years now.
Okay.
Yes. I started off in BPharm. I did my BPharm in the University of Nairobi very many years ago.
How many years ago?
So I graduated in the year 2006. Yes, so I did my internship in 2007. Then I was posted in a hospital in Meru called Miadene. By then I couldn't even get the directions as to where that was. So that was in 2008. And I think that's where my journey for clinical pharmacy, not necessarily oncology pharmacy, began, because I was very clinical oriented. I had to just, above all my other duties, I always had to go to the ward rounds and join the MO and see how we are managing the patients.
What was interesting about clinical pharmacy?
I think the whole idea of seeing, not just being behind the counter and just issuing the meds, it's actually seeing the patient and seeing how they are responding to some of the treatment, giving your input. Because I remember in 2007 when I was doing my internship, especially in Nakuru, our input was so important and really valued, especially by the medical officer, because I realized we are actually the pharmacology experts, we're the drug experts. So that is where my passion and what was so rewarding about going to the wardrooms came about. You place a face to that drug that you're issuing, and the joy of seeing what it's doing for that patient. Yes.
And at what point did you realize oncology pharmacy was now the thing you wanted to pursue?
I think that came a bit later on. For sure, I knew I wanted to do clinical pharmacy. But when I joined the University of Nairobi again to do my master's in clinical pharmacy, I think I was torn between two things. I was torn between oncology pharmacy and critical care. And I feel it's because there's a lot of pharmacy in them. There's a lot a pharmacist can do, and there's a lot of input you can put. But I think my passion was more driven also by role models. I found Dr. Irene Weru, I found Dr. David Wata practicing oncology pharmacists, very impactful oncology pharmacists at Kenyatta. So that gave me the zeal to go on. Also from a personal perspective, I've lost several family members to cancer. So I felt I can do something for someone with cancer, elevate the pain, give them the hope, even with the treatment that we give. So it had both angles to it. And that's where my passion really came from.
For someone hearing this for the first time, what exactly is oncology pharmacy?
So oncology pharmacy is a specialization of pharmacy where we are more concerned about the treatment of cancer patients in general. It's a practice where we are involved in either preparation, patient counseling, giving drug information. It's a multidisciplinary, actually you're part of a multidisciplinary team that is involved in giving cancer treatment to our patients. So in a general view, that is basically what oncology pharmacy is about.
Okay, nice. So what does a typical day look like in the life of an oncology pharmacist?
It's varied.
Okay.
It's quite dynamic. It's not not one size fits all. So I'll give more of my experience. So as I said, it's a multidisciplinary approach. So typically there is the aspect of wardrooms. So we are really part of a larger team when it comes to the care of a patient. So we are really part of also wardrooms. We attend wardrooms and attend to cancer patients. You get to see especially the toxicities that the patients are experiencing. You're really key in guiding how to manage some of these toxicities. When it comes to even the protocols to use, you're really key. Those adjustments, you're really key in all that. We also are key globally in reviewing chemotherapy orders. Okay. You're the first check or the second check when it comes to checking the protocol that patient is on. Are they the right doses the patient is on? And even in our setups, we cannot issue chemotherapy before the oncology pharmacists. or the clinical pharmacist has guaranteed that that protocol is right, the dosing is right, and with that, now the chemotherapy can be reconstituted. So we do a lot of that, the chemotherapy review orders. We also are involved, though there's a lot of task shifting, but oncology pharmacists are also key in the reconstitution of chemotherapy. But nowadays, the task has also been shifted to other cadres, as our tasks now shift to other things also. We're also part of multidisciplinary tumor boards. So the oncology pharmacist is very key. And these are tumor boards that discuss a patient and the best treatment or protocol to give that patient. So we are usually very key. Sometimes you have to look at unique cases where there are some toxicities. You're not sure should we give this drug or not give this drug because of the various toxicities experienced. So as a part of the team, you really come in strongly to advise on such cases and many other things that are involved. So those are just some of them. We also do a lot of patient counseling. So like in our setup, we have what we call the bedside medication therapy management unit or part, and that is very key. That involves counseling the patients in terms of their toxicities, how to take their medication, how frequently they are supposed to come to clinic. So that was actually a gap we had realized within our setup in terms of the patients didn't really quite understand their treatment very well. They experienced toxicities, and that really affected their quality of life as well as even their follow-up for treatment. So the oncology pharmacy team really came in strongly, and we managed to fill that gap very well with the help of course, our pharmacist interns. Yes. So we are really mentoring them to veer to that direction. So oncology pharmacy is quite diverse. It's not only clinically related. There's also the aspect of developing protocols, the aspect of developing guidelines that can guide in how we, do our day-to-day work. Yeah, and even some of the protocols we use are very clinical pharmacy guided. Like we developed a protocol for patients with end-stage renal disease for them to be able to use one of those drugs or regimens that are, that are tricky to use in renal disease. So we really come up with some of these things, and they're very helpful and important for the team at large. Yes.
That's really great.
Yes.
I think it's a gap that was there, and now the pharmacists are able to.
Yes. Yes.
Nice. If a young pharmacist wants to get into this field, what steps can they take?
It's pretty easzy. It's not complicated.
Okay.
I think in this day and age, there are more and more of us in terms of oncology pharmacists in the field. So encourage them to, volunteer in units where they run oncology units or oncology centers. That way they get to get a feel of even what they are really trying to get into. They can also join societies.
Oh,
yes.
Which society?
They're like in Kenya, we have the Oncology Pharmacy Society of Kenya, which is works very closely with the International Society of Oncology Pharmacist Practitioners. So those are societies that, for me personally, especially, were very eye-opening. And from those societies, you can also get mentors within them, network, and just get to know and have someone walk the journey with you in this path of oncology pharmacy. Yes.
So you just go to the website and
yes, you can.
Nice.
Yes.
How about education-wise? What should they pursue? Because you talked about you pursuing clinical pharmacy,
yes,
specializing in oncology.
Yes.
Yeah. What direction should they take? Which campus should they go to?
So it depends on what they're looking at. So in Kenya, currently we have 3 institutions that are offering oncology pharmacy. We have the University of Nairobi, which was the first to do this, which is where most of us studied, the first people, as you can tell. We started that quite a long time ago. So yes, University of Nairobi, it's a 3-year course where you get to do clinical pharmacy, and then you specialize now, you major in something. So currently that's how they're doing it, and you can major now in oncology. Same to Moi University. I think they offer this more or less the same principle, where it's a 3-year course. First you do an aspect of general clinical pharmacy, then you get to specialize in oncology. Currently we have a new program. It's a residency program. It's also an MSc program in Kabarak University. So it's a 2-year program, and that one is directly an oncology pharmacy program. So there's no first doing clinical pharmacy, then doing the oncology pharmacy component. You just go direct to it, and it's a 2-year program. You can also study outside. There are those who managed to study outside, like the University of Birmingham, one of our oncology pharmacists, and I think one other I know of. I've studied in the University of Birmingham, where they do an MSc in clinical oncology. So that also gives you a specialization in oncology pharmacy. If you can trend into the US, the better.
The better.
There's also US. So US, they call it a postgraduate year 1 and postgraduate year 2, where you now get to specialize in oncology pharmacy. But you can just start from a postgraduate year 2 oncology pharmacy, but you need some years of experience for you to do that. So if you can venture into that, that's still an option. Yes. So you're not only limited to the country.
To the country.
Yes.
What is the difference between oncology pharmacy and radio pharmacy? Then people look confused there.
Oh yes, there are those who approached me thinking I'm a radio pharmacist. So I had to really clarify they are a bit different. Yes, they are both specializations in pharmacy. For us, for oncology pharmacy, it's more concerned about cancer treatment, basically. For radio pharmacy, in a nutshell, it's like, I know Dr. Itosha likes saying it's like a manufacturing plant. They actually have to be registered like a manufacturing plant where they produce radioisotopes or radiopharmaceuticals that are used for diagnostics and treatment in cancer and in other conditions. So there's ventures, it's not just cancer. So for them, they can even do in cardiology aspects of diagnosis and all that. So theirs is a bit wider and it's more of manufacturing. That's what she says. In actual sense, our radio pharmacy is registered as a manufacturing unit. Yes, because they manufacture the radioisotopes. For us, it's cancer treatment. We are purely on cancer treatment. And other than compounding, we do other things, as I've said, the clinical component, supply chain still, if you want, you can still go into that direction.
Okay. Are there subspecialties within oncology pharmacy?
Yes, I think we can call them some form of subspecialty if you want to venture further.
Okay.
So oncology pharmacy is quite dynamic. Currently, we are moving to what is called precision medicine, where we are targeting what altered genes do you have so that we treat you. So that's what we call next-gen sequencing. We have pharmacogenomics, why we respond differently to drugs. So those are fields you can subspecialize in as an oncology pharmacist. And that is actually where the world is moving to, precision medicine, next-gen sequencing. So I think that is one area that if an oncology pharmacy was to venture into oncology pharmacy right now, that's the area, that's a very exciting area to move into because you get to see some of the mutations and how can we target those mutations. You can even move to investigational, where you're targeting, these are the mutations, what drugs can we give, research. Those are some of the things. I know of an oncology pharmacist who ventured into supportive care purely. Wow, where you're just managing the toxicities for these patients and coming up with guidelines on, how to support these patients. So it's quite dynamic. It's not limited in any way, and it's really growing. Yes.
That's great. Would you require like AI skills for you to venture into some of these subspecialties?
I believe so. I believe the world has moved to AI, and someone was actually telling us we will be rendered redundant if you cannot utilize AI. So definitely there's room for AI, and I think for anyone in this day and age, AI has to be something you have to factor in how you will apply AI in your field, in your career. So oncology pharmacy is not excluded. In fact, that is where we are all headed.
Nice. What are some of the myths and misconceptions people have about oncology pharmacy?
I think I noticed this with a lot of people. There's a myth or misconception that you will experience toxicities if you're of childbearing age. This is not the time to enter oncology pharmacy. But I think those are misconceptions because nowadays, given how we started and we are still here and we have our own families, nowadays there's a lot more that is happening in the field in terms of safe handling. Yeah, so you're quite protected. Because nowadays we cannot have any oncology pharmacy unit, let's say, without a biosafety cabinet. That really protects you as a healthcare worker. We're using closed system transfer devices. Nowadays, we're moving to clean rooms to manage our patients and mix our chemotherapies. So with that, the exposure is very limited. So I think one of the misconceptions people have is you'll really be exposed to these toxic chemotherapies and you will not be able to get children. You'll be infertile, but I think that's a misconception. Yeah, we've been in this field and we are fine.
And you're fine.
Yes, and God has given us children. Yeah, even while practicing in the field. Yes.
Oh, that's good.
Yeah.
What's that one thing you had to unlearn when you started working in oncology?
Not so much unlearn, but relearn.
Okay.
Yeah, there's a lot that has changed and keeps changing. So the things I was taught in school are really not what is being practiced right now. So I had to really relearn some of these things. It's a changing world. We're moving away from the conventional to targeted therapies. There's a lot of research and movement towards such kind of treatment for our patients. So I had to relearn some of those things. Safe handling, also that has really changed along the way. We've become better and better in how we are handling our chemotherapies. So we had to relearn some of these things. Not so much unlearn, but relearn some of these things.
Okay.
Yes.
And what is the most interesting and rewarding part of working in the oncology pharmacy sector?
I think the most rewarding part for me would be for our patients.
Okay.
Yes. Recently, we had what we call bell ringing for our children in oncology who actually had achieved remission. It was really a very rewarding time for most of us, because you feel like your effort is going somewhere. It can be very discouraging, because also for most of our patients, the prognosis may not be very good. Some of our patients, actually a good number, depending on the stage of the disease, with time they succumb to the disease. But the most rewarding part is, of course, for those who come back and say, thank you. This journey we have walked and we are in remission. We are doing better. But also, even for the ones who might not be in remission, I think the other rewarding part is the dignity awarded to that person, in terms of just giving them the fighting chance, the hope, just making their life a bit better in terms of quality of life, be it how we are managing their pain, how we're managing the infections. I think that's important still. Yeah. Even not giving up on these people. I think that for me sometimes is a reward, even from the patients themselves. Yeah. They feel you're giving them the hope, you're giving them the fighting chance. Yeah.
That's great.
Yeah.
There's a pharmacy student watching this,
Yes.
and they are interested in oncology pharmacy.
Yeah.
What one advice would you give them?
I think I would tell you there's a lot of opportunities for you in oncology pharmacy. It's a growing field. It's quite dynamic, and it's a very rewarding field. It might not seem so sometimes, but it's a very rewarding field. And it's for me, it is a God-given platform for me to serve God's people in one way or another. So if you're really passionate about it, go get it, go do it. We are here. There are very many mentors out there. You can really reach out to any of us in terms of the oncology pharmacy field. Join society and get to meet some of these people and network, and have someone walk this journey with you. But it's an exciting field that is really growing. Yes, thank you.
Nice. Thank you, Dr. It was nice having you.
Thank
you
you
for the wisdom and advice that you've given us, and the information that you've given us. I'm
Yes.
sure there are many people who will gain from it.
Yes.
Yeah, it was nice having you around.
It was a pleasure, and thank you for this opportunity.
Thank you.